Asime Patrick is a motorcycle taxi rider operating in Hoima district. He has never tested for HIV, but today he has an opportunity because this initiative specifically targets most at-risk populations in urban centers, including the motorcycle taxi industry, now employing a large number of young males called boda boda riders. This is part of several interventions being implemented under the Fast Track Cities initiative.
Nizekana kwekebeza yesanga ndi mu mezi tina karole konda mubiri gwange era no bundagaruko yomuka nja kuba ni kunyambisa mukazi wangu muka kuyebunda abaganyo hibo kagenda heru ningena nakapira.
UNAIDS through AMICAALL is supporting urban authorities in Uganda to implement the Fast Track Cities initiative. The Fast Track Cities initiative was launched by the Paris Declaration in November 2014, in which global urban leaders committed to fast-track urban response to HIV and AIDS to achieve the 1990 targets by 2020 and end HIV epidemic by 2030. The commitments are: 90% of the people are tested for HIV and know their status. 90% of those who are found to be HIV positive are put on antiretroviral therapy. 90% of those on treatment must maintain complete viral load suppression. Fast Track Cities initiative in Uganda was first piloted in the 5 municipalities of Entebbe, Hoima, Lira, Soroti, Jinja and the Kampala Capital City Authority, mainly focusing on the urban leadership engagement, community engagement and provision of HIV and AIDS services, among other health services.
There are populations within the urban areas that are left behind. Where we have adequate information in the urban areas, where we have people who are more educated in the urban areas, we have access to information. Many times the urban populations do not get out and access services. And it's because of that that the Fast Track Cities initiative was put in place by the Paris Declaration. The objectives of 1990 is basically to accelerate access to services within the community, advocacy, mobilize the communities and push to reach all the communities within the urban areas.
AMICAALL, with support from UNAIDS and other implementing partners, has been able to provide comprehensive health services under this initiative, which include voluntary counseling and testing, safe male circumcision, cervical cancer screening, blood donation, immunization, condom distribution and distribution of IEC materials. AMICAALL first held consultative meetings with stakeholders in the 5 municipalities and capital city to introduce the concept of Fast Track Cities initiative to the urban leadership and partner organizations. The meetings were also used to identify partners to be engaged in the implementation process and to rally them for the rollout.
We expect a convergence of partners under the leadership of the urban centers to internalize the evidence and support joint planning, because we realize that there are many partners in those places, but they are not necessarily working with the urban authorities. We hope we can strengthen that coordination and therefore bring everyone to agree this is our problem, so and so is addressing it here. There is still a gap here which needs to be filled, so that we can move together and after some time check, have we achieved the result.
From the beginning, the interventions were spearheaded by the local leaders. The leaders led by example by participating in the marching through the towns and taking HIV testing publicly. This helped in galvanizing support for the interventions.
HIV and AIDS is not just a medical issue. It requires also leadership. And where leadership is absent, it's likely that the community suffers because they have no direction. For information where services can be obtained, and also to coordinate the implementing partners within a locality. We want to see that we provide leadership that can help tackle this problem amidst our community.
At the different selected outreaches using bands to march, dance, songs and drama, large numbers of people were mobilized to utilize the services being offered. The use of outreach camps ensured that services were brought closer to the people who needed them most.
Obubaka nabuwulidde ku radio nga balanga nti wano ku Main Street wagenda kubawo okujjawo omusaayi okwekebeza nange nenzija. Nze nva kujja kufuna service yakwejjako omusaayi kutegeera obulamu bwange bwe buyimiridde. Service okutwalizaamu ndisanyukidde njagadde kuba bampadde ne kondomu zino zoolaba nga zino zo zange.
Many people turned up for circumcision, including 10-year-olds who were also targeted under the initiative. Safe male circumcision reduces the risk of HIV infection by 65%.
We are here to do the cervical cancer screening. Cervical cancer screening, the cervix, the cancer of the cervix, and offering long-term family planning. Let's see, IUD, and then the implant.
The services have been good. They have tested me. I'm negative. That's all. I encourage other people to come and attend this service because it helps the youth.
The people also got vital information on HIV prevention using the abstinence, be faithful and use a condom model, care and treatment for HIV-positive clients, and as well as referral for further management of health conditions. The people were also able to access family planning information as well as services. Outreach activities took an average of 2 days per municipality, and by the end of the campaign, a lot had been achieved in such a short time. These have been achieved using limited resources, mainly because AMICAALL put the urban leaders at the forefront of the planning, mobilization and advocacy. One of the biggest challenges in achieving 1990 targets is ensuring that everyone who is found to be HIV positive is put on treatment. It is estimated that 1.7 million Ugandans are living with HIV and AIDS, but only 800,000 are on antiretroviral therapy, with 80% of antiretroviral therapy being donor-funded.
What does it cost on a Friday for all the mosques in this country, or 50% of the mosques in this country, to give a message on HIV, to encourage people to test for HIV? What does it cost? What does it cost for all the churches in Uganda? Even 50% of them, either on a Saturday or on a Sunday or whichever day, that the person who is leading the prayers in the church, what does it cost to pass that message? In fact, I'm taking this opportunity to call on the government of Uganda to really see that the actualization in the establishment of the HIV and AIDS Trust Fund. And I think the leadership of Uganda, the people of Uganda, individuals and the family, I think they have a moral responsibility to see that more resources are put rather than depending from outside. The danger, I'm not saying it will happen, but in case something happens, they stop. What will happen?
Constraining laws continue to hinder certain categories of people, like men who have sex with men, drug users and sex workers from accessing HIV and AIDS services because they are stigmatized and discriminated against. However, this is being overcome as more leaders are sensitized about the existence of those kinds of people and also using of peer educators to reach them. Because of limited resources, the interventions were implemented in 6 out of 32 municipalities. There is also need for urban leaders to have concrete HIV and AIDS data, which will inform the planning and budgeting process. Some municipalities have mainstreamed HIV and AIDS issues into urban authority development plans.
In Jinja Municipal Council, we have the HIV workplace policy in place. We have even budgeted for AIDS-related program in our local budget here in Jinja Municipal Council.
This campaign has shown that by providing comprehensive services using outreaches in urban centers, many people are able to access HIV and AIDS services, making the 2020 90-90-90 target a reality. There is need to involve all stakeholders and partners, and the campaign rolled out to other urban areas if the goal of eliminating HIV by 2030 is to be achieved.
First of all, I'm very grateful to the donors and other stakeholders who have been working with us as Alliance of Mayors as we combine the efforts to fight HIV/AIDS. Uganda's economy is not yet self-sustaining. As we fight to sustain our interventions, many people listen to their leaders because they are their own choice. So I want to appeal to our donors to give us more funding as we target 90-90-90 and as we fast track in our cities.
Call upon government to support the urban areas and push for the cascading of fast track initiative as an approach in urban areas, and reach out to all the 174 town councils that we have had, reach all the municipalities that we have, and in our city, Kampala. Or else it would be very difficult to achieve the national strategic plan goals when the urban areas are actually remaining behind. They remain the epicenter of the spread of the epidemic. They also remain the areas which have the highest HIV prevalence.
Overall, new infection in the country has reduced from 140,000 to less than 100,000, a reduction of about 29%. That is December 2014. So we are seeing progress. So that's why if we pay attention to these areas, we will see more and more impact. And that's what I'm saying. I don't think we need even to wait. Uganda should not wait to reach this 90-90 by 2020. Uganda can make it. Uganda should make it. Uganda must make it by the end of 2017.